it's April 2021, you're a data analyst at Pfizer, and we are going to present this dashboard to the board members. Why? Because the first quarter is finished. We are analyzing how our vaccine is impacting world facing the COVID, and this are the data you are going to present. First, we are going to point out is the relation of death across time. We are sadly noticed that even if the vaccine is on the market, the trend of the global death are still increasing. Even if this sad news, we have to point out also, but this is a good news, that the proportion between death and confirmed case is decreasing. So with these two charts, we can notice and we can point out that actually the trend is still going up, but the proportion between death and confirmed case is slowing down, is decreasing. So our vaccine is having a good impact on the world, is having a good impact on COVID disease. How can we understand this in a better way? With these two charts, these two charts are showing the worldwide map, and the orange one is pointing out the confirmed case all over the world, and the red one is pointing out the number of deaths. So we can see that actually the country with the most number of confirmed cases are Brazil, United States, and India, and the map of death as well, Brazil, United States, India, and also Mexico. There's a big missing here that actually is China, where we notice and we know actually that data are not clear. The process in which China is collecting data is not clear, and we decided not to trust this data anymore as well for Africa, but because we know they are facing other type of problem, and so it's not because trust of data, but it's more because of the quality of them. So in conclusion, we can say that actually when on December 2020 we had the opportunity from the World Health Association to sell our vaccine on the market, to sell mainly in America, North and South America, and Europe, was correct. Our decision was correct. Now we are able, with data, to prove that the vaccine is working, we can say also pretty well in the first quarter of our sailing. And we can also say that this country are giving us a very high quality data in order to make our assumption even better.
When analyzing the data for our vaccine and the vaccines globally, if filtered by the Pfizer-only vaccine, we can see that the concentration of the vaccine actually started in the north, but it went to the south countries as they reached demand, and the capacity of the Pfizer vaccine as well as logistics was able to move through, improving the distribution for almost all South American countries, for except from Venezuela because of political reasons. And as well, it wasn't able to reach Africa because Africa does not have as high demand because of their population density, and as well because it's not a very high income state. Therefore, it is not as reliable as a market. Now, when analyzing the vaccines, it is possible to see that each vaccine can be combined. And not all the vaccines have only one dose. Our Pfizer vaccine actually started with 2, and then it started growing to 3 until 4. So that means that the number of vaccines is going to be way higher than the number of population as well as the number of confirmed cases. Therefore, China as the starter, it's an outlier with a lot more dedication for vaccines as well and requirements. But it's followed by the US that has the higher population and Brazil. So what we can see is that the people that have the major doses administered are countries that have high income, high population density, and as well they have a high demand because they have a very high number of confirmed cases and deaths. So based on that, we can see the rate of vaccination, and because not all the countries require the full vaccinations to be fully completed, and they only do once, the rate of partial vaccination is way higher than the rate of full vaccination. But they follow the same trend, the same cyclical trends, and actually the fully vaccinated after the second time the COVID took strength, it began to rise again, while the partial vaccination started increasing because there are more people now vaccinated. But as well, what we can see is that the Pfizer vaccine, although not being the only one administered, it was combined with a lot of variants of the vaccine, such as Sinovac, Moderna, Johnson, in order to strengthen, because there was as well a belief that the more difference of the vaccines you have, the more you were protected from other types of coronavirus.
Recoveries, it is possible to see that Brazil is benefiting the most. Brazil PC2 shows the major number of recoveries from the Pfizer vaccine, and that there is a constant rate of recoveries across time with minor peaks showing an almost semi-stationary line of movement. This highlights the success of Pfizer as an effective vaccine to fight COVID-19 and also demonstrates the effective logistics Pfizer has put into action as southern countries that are most affected by the pandemic are seeing the vast majority of recoveries even with compared to more highly populated areas like the US or China. Pfizer remains one of the vaccines that remain on PC3 from the relation of doses administered and the number of recoveries, demonstrating small cap market behaviors like vaccine accessibility and healthcare infrastructure, and demonstrating the reliability of the vaccine in the aid of recoveries, facilitating symptom recoveries and less strong effects from the virus. Its distribution is very concentrated and very few data points are located over the concentrated data point area, therefore indicating that these other countries may have been part of fiscal policies that aided the results.
As well, what we can see is that the distribution of recoveries from vaccines, see that the mainly distributed are the ones that are actually combined with the Janssen and AstraZeneca from the Pfizer, as this dashboard is filtered by our Pfizer vaccines. But this is because there is a belief that the more vaccines you have, the more variations of the coronavirus your immune system is ready to face for. So it's actually, the market is demanding a lot more of combination from the vaccine. And as well, in the market, it is possible to see that our best location actually is South America, and we should focus our efforts and as well as marketing on South America because it's reliable. There is an ongoing trend of confirmed cases, and we should get up to it.